Part 2. Okay. So, I'm going to show you something. On WhatsApp, when you look at the group that we are in, you can see, I can't see on this screen, but if you look at the bottom, next to the camera is the microphone. And when you press on the microphone, if you hold it down when you are talking, you can record your voice. So you can record the conversation that you wrote and send it either to the group or just to me. That way you can practice your pronunciation. So let's continue. We are going to talk about asking questions about health and health problems. So turn to page 210 in your book. That's this page. When you are asking about health, you ask the question, how do you feel? How do you feel? If you are talking about another person, you can say, how does he or she feel? Or how does Alex feel? How does Carlos feel? Right? And the answer is either I don't feel well, or I feel well, or a specific problem, like my throat hurts, my tooth hurts. How do you feel? I have an earache. I have an earache. If you are asking about a specific problem, then we use the verb have. Do you have a fever? Do you have an earache? Or if you are asking about another person, does he have a toothache? Does she have a headache? Right? So now I want you to pause this video and complete the sentences. So pause the video, complete the sentences, and when you are done, resume the video. Okay? So, pause. And resume. So I will read the part of Mom, Doctor, and Maria. Doctor, I'm worried about Maria. I think she has the flu. The doctor says, how do you feel, Maria? Maria says, terrible. I have a cough and a stuffy nose. The doctor says, what about your throat? Does it hurt? Maria says, yes, it does, but just a little. Do I have a fever? So the doctor says, let's see. No, you don't. The mom says, does she have the flu? And the doctor says, no, she doesn't have the flu. It's just a bad cold. That's good. I feel a lot better now. I feel better. Better. Mejor. Right? So, now let's talk about going to the doctor and the doctor's instructions. So, when you go to the doctor, do you see a doctor who speaks Spanish or Creole or Portuguese? Or do you see a doctor who speaks English? Maybe one day you will have an emergency and you need to speak English with your doctor. Or maybe your son or daughter's doctor only speaks English. So let's be prepared for when that happens. Please turn to page 212. Here we have 8 pictures of different things a doctor will ask you to do. Number 1 says, step on the scale. The scale is something that measures your weight. Now, look at the other options, right? Look for words that you recognize. Some of these words are new. But if you look, for example, at this one, open your mouth and say, ah, we know the word mouth, right? Your mouth. So, where do you see someone's mouth? Here, in picture 4, right? So number 4 is open your mouth and say, ah. Try to complete the whole page, okay? So, pause the video, complete the page, and then resume, okay? So, pause. And resume. Number 1 was the example. It says, step on the scale. Number 2, roll up your sleeve. Number 3, sit on the table. Number 4, open your mouth and say, ah. Number 5, look straight ahead. Number 6, take a deep breath. That's a breath, right? Number 7, lie down. And number 8, make a fist. This is a fist when your hands are like this. Fist. Right? Okay. Now, when we take medicine, right, there are instructions with the medicine. If you take medicine orally, that means you swallow it. Oral means with your mouth, right? So, if you look at the pictures at the top of page 213, here we have the word orally and someone taking medicine with their mouth. So, what are the other words? Take a minute to finish the other words. Okay. Number 2 is a tablet. A tablet is something that is sort of this size and shape. A little pill. Number 3, operate machinery. Right? That is a machine. Number 4, out of reach. To reach means to be able to touch something, right? So, these are vocabulary words that we use for instructions with medicine. So look at the Cold Away bottle. It says, Cold Away, tablets, pain reliever, antihistamine. See back label for warnings and information. Right? So look at the instructions on the back and listen carefully to what I say and write the words or numbers that you hear. Okay. Cold Away, pain reliever, antihistamine. Directions. Take 2 tablets orally every 6 hours. Warning. Do not take more than 8 tablets per day. Take with food or milk. Do not drive or operate machinery. Do not give to children under 12. Keep out of reach of children. Okay, so you can rewind and listen to it again. Then we have Max Coldaway. When you see this abbreviation or this short word max, it's short for maximum, which means the most. So Max Coldaway is a stronger medicine. It's Coldaway, but it is stronger. So read the directions and finish and answer the questions next to the instructions. So pause the video to do that, and then resume the video, and I will go over the answers. Okay? So pause and resume. What is this medicine for? It is for pain or cold. How much of the medicine do you take at one time? 1 tablet. How often do you take this medicine? Every 4 to 6 hours. How much of this medicine can you take in one day? 6 tablets. What do you take this medicine with? Food or milk? What age children cannot take this medicine? So basically, children of what age cannot take this medicine? Children under 12. What age children cannot take this medicine? A little bit of a confusing question there, but the answer is children under 12. Okay? That is part 2. And part 3 is next.